Let's talk about headache today. Alright, we have primary headache, we have secondary headache, and today we are not just talking about if you are feeling headache, what to take and will just stop the pain. No, we are trying to discuss what the pain is and what causes it, and what the pain is telling you that is wrong with you. Alright, we have primary headache, we have secondary headache, and primary headache, that's the headache that you normally feel. It's a general headache that can be due to stress, hunger, then something like that. Then apart from that one, we have secondary headache. Secondary headache is not that, is that headache that is telling you that no, I'm not only having headache, but there's something in me that is causing this thing. Now let's go. We have primary headache. The primary headache is classified into different categories. Number one category is a regular headache. That's the one that normally occur to everybody. You feel headache like because you are pressing your phone too long, you are not sleeping, and also you are not eating. Stress also. Those are the things that cause a regular headache. Another one is migraine. Migraine is that headache that take part of your head, one part of your head. That one, it look as if you are even dying. It's very painful, but although it do last for hours or a day. So this migraine headache, you don't feel headache when we say you don't want to even hear any noise at all. You will go to the room, lock everywhere, just because any slight mistake you will just feel the severe headache. That's migraine. Another headache is cluster headache. This one is very rare, but it's very dangerous. It's that one that this is your part of your eye, that's where you feel the pains. Those ones are cluster headache, and that one is so severe that it can even occur for a week and it will disappear, but that eyes will look waterish and the rest. You understand? So let's just come to this secondary headache of a thing. These are headache that you ought to be what? These are headache that need emergency. When I say emergency, it's emergency. Number one is thunder clap headache. That thunder clap headache, it can be those, and most times. So this headache, you can be sitting down and something will just feel like say it hits on your head. Yes, that one that cluster headache is an headache that simply shows you are having what? You are having a bleeding in your head. There might be bleeding. That one you need to go for scan, a brain scan. Then another headache that is also common, you have those headache that go with fever and stiff neck. You can't even bend your neck. Maybe if you are pressing your neck, like, so you are telling someone to press it for you, yet you can't press it very well, and yet you are still having it. You see, those headache need severe attention, because that kind of headache can be due to meningitis, which is meningitis is an infection of the what of the covering of the brain. Imagine something covered your brain, you can't really think well. Those are here. That is headache, fever, stiff neck. If you can't even shift your neck, then another thing you need to know about is headache that just keep knocking on your head, bang, 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 as if something is there. You need to go for a brain scan. It can be due that there is an injury in your skull or injury in your brain, and headache with sign of stroke. That's another headache. That one now you can't even move. It will start as if you can't even shake this hand. And the thing is, you can be talking like your mouth will bend, like you understand. Then if not care is taken, there's a possibility that is stroke that want to occur to you. Then we have another one that is continuous headache. That continuous headache do happen to like the age of 50 and upward. So if you notice a continuous headache like that, you ought to do what? Go for a brain scan. And another headache we do talk about is medication overdose. So there are some headache pills you do take that it will come and go after you take the the drugs, it will stop, then it will bounce back again. You see, so we call it medical induced headache. That's how it's being called, and it's mostly common with people, those that do continue taking how is it called, painkillers. That, in fact, that particular headache, that medical overdose, that simply shows that once a painkiller is taking 2 weeks and you are still taking them over one particular head, it simply shows that the drugs now became a part of the problem you're having. If you are taking painkillers over 2 weeks, the medicine you are taking became part of the problem you're having. Now, what should I do? That's the question. Number one thing you should do is take record of your headache. Take record of your headache. Simply shows the time it started, what you ate before it starts, or what really triggered your headache. You understand? Take those ones, those scores. The another thing you should do is small remedy. Their headache, it can be regular headache. Those ones now, you just need rest. Due to stress, you just need rest. Take water, or you take food, because some of the headache are due to hunger. Then another thing you should do, stop taking excess painkillers. Don't take it as a morning, afternoon food. It's not right. It's not right. Then another thing you should do is check your BP, because BP do triggers headache. Check all your BP. Then if you are a lady, a pregnant woman having headache, that can be due to what we call pre-eclampsia, a dangerous high blood pressure during pregnancy. You need to go to the hospital if you are having all these ones. Then if you know your headache is just minor one or irregular one, there are things you ought to take, and all I will say is that make sure you are taking care of yourself over there, because health is wealth. Alright, Dr. Christian, love you. Take care. Be careful out there. Alright, love you guys. Take care of yourself.